And good evening, everyone, and welcome to this episode of the Ask Dr. MJ. Why? Because your health is important. Facebook Live, YouTube Live, Instagram Live, and now TikTok Live presentation where we give you an opportunity to ask your healthcare questions. This is the only interactive forum that allows you, the caller, the listener, the sign-in to participate actively and live. This is your medical ready reference, and we are live here to answer your questions. As always, if you were listening this morning to the RSMS, the Rickey Smiley Morning Show, you know that I talked about medications and vaccines in particular that have greater benefit beyond what their original constitution was. And that is, we talked about the shingles vaccine. I have not been a big proponent of the shingles vaccine. I'm a big proponent of the flu vaccine. And I tell them, and that's the one that nobody gets, and people tell me they don't like it, it makes them sick, etc. But then they'll ask me for the shingles shot immediately. In the same conversation, I say everything that you just told me about the flu shot applies to the shingles shot, but you want the single shot. But I say chance of you getting shingles is minimal. Chance of you getting the flu is the most infectious disease coming through the winter, and it has the largest amount of sequela. So, if I got to make a choice between the two, that's the one I'd like for you to get. And so we talked about how getting the flu shot not only protects you, hopefully, from getting the flu, but if you do get it, you'll have a milder version and it won't last as long. It won't be as debilitating. And so that is one of the reasons that you would want to get the flu shot. The flu shot is now synthetic. It does not give you the flu. It does not cause disease state. The original flu vaccine did do that. And when you took the flu shot, it literally gave you the flu with the objective being that you would have a mild case, but in some cases it made people really sick. So that is why now it's perfectly safe. It doesn't cause disease. It just gives you the benefits. So in addition to protecting you from the flu, we found out that its anti-inflammatory abilities decreases your chance of a heart attack or a stroke or cardiovascular sequela, and it decreases your chance of getting Alzheimer's disease and other dementias. So good reason to get the flu shot. It's a good match with this season, and we want you to do that. There were other medications that I spoke about, particularly Viagra and Cialis. Viagra, in addition to its primary indication, which is now for erectile dysfunction, originally it was developed to treat pulmonary hypertension. It is now being redirected back to pulmonary hypertension because it's one of the few drugs that will do that. But it also has been shown to have great benefit in decreasing your incidence of dementia, particularly Alzheimer's. And I think because it improves blood flow everywhere, that the improved blood flow to the brain gives you healthier brain tissue. It prolongs your cognitive abilities. So that's where we are with that. Today, we have a special guest in the studio. As you can see, Dr. Shawn Garrison, Dr. G. She is a psychologist. She is a PhD doctor, and she is going to answer and discuss all of your psychological issues. So we're going to do mind and body today. I'm going to answer your medical questions. She's going to answer questions about everything that are mental health and interpersonal relationship questions as well. She is I consider an expert on things of that nature. So if your relationship with your significant other, male, female, all of those things, she's going to answer those questions. And boy, it's going to get hot tonight. So Shawn Garrison, how are you this evening?
Hello, I am so excited to be here. Thank you so much for this opportunity. This is fantastic. We have known each other for a minute, and I am so grateful that, that's still in effect and that we are still doing the thing we're supposed to be doing out here in the world and specifically in Atlanta. So thank you so much for this opportunity. I'm so grateful.
You are more than welcome. And what Dr. Garrison is referring to, that she attended Spelman College. I attended Morehouse. My senior year, I took every course over on Spelman's campus. That's one of the benefits of being in Atlanta University Center. You could take classes at Clark Atlanta. You could take classes at Morris Brown. So my senior year, I had completed all of my requirements to go to medical school. So I took all my classes over at Spelman. And most of them were psychology courses. I was trying to learn, and I was considering getting a secondary degree in psychology as well. But so we shared multiple classes, and we became good friends at that time. And so since then, she went on to the University of Georgia to get her PhD, and I went on to the Medical College of Georgia to get my MD degree. And we, being in and around the city of Atlanta, Morehouse School of Medicine and everything that's health-wise in the city, we've kept in touch. And so we had an opportunity to reconnect And I said, it would be wonderful if you could share your expertise with us on the Ask Dr. MJ, Your Health is Important broadcast. And she agreed to do it. And we're going to have her as a regular guest. So you can be planning on. We'll let you know when she's going to be available so you can get your healthcare questions ready. Okay, Holly, let's do a roll call. Who's out there? Tell us who you are and where you're signing in from. I want north, south, east, west. Okay. Rhonda Holland Young. Okay. Thank you. She's greeting you also, Dr. Garrison, and everyone in the chat.
Hey,
all right. Very good. Okay. Winnie King. Hi, Winnie. Thank you so much. Winnie's from Terrell, Texas, and she has been with us from day one. We appreciate you and thank you for sending those blessings. I appreciate it. Okay, Linda Bloomer from Birmingham, Alabama, Bright Light City. Great things happening. They have the Magic City Classic in Birmingham this weekend as well. Linda Everett, good evening. And also Dr. Garrison from Warner Robins. Glenda has been with us now for a while too, and we love everyone in Warner Robins. Barbara Williams, good evening. How are you? Barbara, where you from? You didn't put that information in there, but she's signing in through YouTube. Lynn F. from St. Louis, West. Now we are Midwest. St. Louis is out there, and she's on YouTube as well. Marie Adolacum from Houston, Texas. Okay, Houston finally is cooling down a little bit. Houston is now livable after having triple-digit temperatures for a while. Sean Big Time Green. Dr. Garrison, Sean was one of my first male followers, and he's been with us for a while. And I love it when he tunes in because he tells all the other men to sign in, and he's just a great person. Okay, Stephanie Smith. Hello, Stephanie. How are you as well? Barbara Williams, good evening from Levels D. All right, Barbara, thank you so much. We appreciate you being here as well. Cherie Woodstock from Fort Lauderdale, Florida. Cherie, I thank you for taking the time to tune in. I hope that you are safe and that the weather that was there did not negatively impact you too bad. Stephanie Smith from Stone Mountain, Georgia. Thank you, Stephanie. You corrected. Stone Mountain in the house. Mitch Potnot from Texas. All right, Mitch, we appreciate you as well on Facebook. Okay. Carolyn Brown from Michigan. Thank you, Carolyn. We appreciate that. You can see we have Facebook, we have YouTube, we have Instagram. Cheryl Jackson, Cheryl from Arkansas. All right, Cheryl, thank you so much. That's again West Albany, Georgia. Now we're going south. Leonard Reed. Leonard, that's a new name for me. Linda Tillman. Hello, Linda. Thank you so much. We appreciate you tuning in from Augusta. Thank you, Augusta, Georgia, home of the Medical College of Georgia. Vanessa Sanders from North Carolina on YouTube. Thank you, Vanessa. We appreciate you as well. Tracy Fudge from Noonan, Georgia. All right, Tracy, thank you so much for being here as well. Mary Lindsay, Dayton, Ohio. Okay, Mary, thank you so much for being here. Makiba Boland, good evening. All right, good friend, and she's local, and we appreciate you tuning in. She's always here every week. Thomasine Morris. Hi, Thomasine. We appreciate that. I have a relative named Thomasine. We might be related. Okay, Bertha Point from South Carolina. Thank you, Bertha. I hope you were not impacted negatively as well. Cheryl Bethune. Good evening, Cheryl. Thank you so much. We really appreciate you. Thomasine Morris, Birmingham. All right, Thomasine. We appreciate that. Jacqueline Nelson Butler from Rincon, Georgia. Not heard of Rincon. Have you heard from Rincon?
No, I have not.
Okay. All right. Thank you so much, Holly. We appreciate that. And we're going to do a roll call again a little later. Dr. Shawn Garrison, again, your level of expertise is unparalleled in this field. Tell us what the topics you're going to introduce, but I want to remind the listeners that this is your show. Whatever your question is, she's going to get to it, but we want you to start off with points that she'd like to make. Go ahead, Dr. Garrison.
Okay. So I just really want to talk about the basics since I'm just y'all getting to know me. So we're just going to talk about what mental health is, what it looks like. And then we'll talk about what relationships, healthy relationships look like. And then I'm going to take your questions, which will cover a plethora of topics, I'm sure. So just let me tell you, I tend to work with younger people, which is really wonderful because it keeps me interested in how things are moving forward. But I'm going to tell you some things change and a lot of things don't change. So let me tell you mental health. First of all, just the basics. We tend to like to think about things in absolutes, but mental health is not an absolute. It's on a continuum, just like physical health is. It's not like you mentally well 1 minute, then 2 inches over, you mentally unwell. That's not how it goes. So I want people to understand that. But let me tell you about maybe 3 or 4 things that carry mental health. First of all, it's a sense of well-being. Secondly, it is dependent on a belief that you can cope with diversity. Then another hallmark of mental health is that you have the capacity for, the ability to be content. Like sometimes you can just be okay. Also, and this is really important for intra with yourself and interpersonal with other people, you got good insight and judgment. And this good insight and judgment is something you have to build and develop, but it's based on reality testing, and that you are willing to assess yourself and assess others based in reality. Now, so what does this look like? What it looks like is you do good self care, that you recognize because you're paying attention to yourself when you need to be cared for, and you try to do that. It also looks like sometimes you have some peace. This America, many of us are of color, so we don't have peace all the time because all God's children got issues. However, that you do have peace, you know what it feels like, you know what it looks like. And what this also looks like is connection with others. You are connected to maybe more than one group, but you are connected to someone outside of you, because human beings have to have that connection in order to stay well, healthy, and alive. Also, what it looks like is that you have developed some coping skills, and that you have a good balance, or you're trying to get a good balance of mind, body, and spirit, because we know that that is just as real as everything else. So, mental health is one definition. It is on a continuum, and then it presents itself in a lot of different ways. Taking care of yourself and believing that you can. Now, just let me put this little plug in here. Black folk, especially, are diagnosed with, let's say, depression less often than other folk. But when we do get depressed, it's a deeper, more serious diagnosis. It is not because we are crazier, it's because we wait too long. We wait longer and we don't say that. So I'm just going to put this little plug in here. You need to go and talk with someone, accept what's going on, accept help early. Now, relationships. Let's talk about relationships. So a good, healthy relationship
A
has
good,
a
healthy
lot.
relationship. Yeah.
A good, healthy relationship has got some very important parts to it. The most important thing is that there's respect. There's mutual respect. What you're going to hear a lot about is reciprocity, that people are giving as they are getting, but giving according to what the other person needs. So you respect each other, and everybody's not the same. So everybody doesn't give the exact same thing and then get mad what you gave didn't work out. That doesn't work. Trust and support, which is built, honesty and responsibility. And please understand, these goes in both directions. And again, I have to say that the responsibility is what it is that people decide, okay, I'm going to do this, I'm going to do that, and we agree, but you are responsible and accountable for yourself. Open communication, that doesn't mean that you get it right every single time, but that what it means with respect and reciprocity, each person gets to say, I don't understand what you said. Please explain that to me. You get to stay in it until you actually understand. And then, of course, intimacy, which is really important. This is the sexual part of a relationship. This is the physical part of the relationship, but it's the private part. It's the part that is very vulnerable. And this is where you also can grow. This involves, again, respect and reciprocity. So what works for one person might not work for the other. And if y'all in the same room at the same time with the same bodies, y'all got to come up with what works for each other with respect and with love. And then secondary to that is physical affection, which is not the same thing always as intimacy. But there is also a public display or a general, not in the bedroom display, where you still have that connection, because human beings need to be connected in more than one way. That means, again, that everybody or the two people, whoever's involved, agree on what's good, what's comfortable, and that it can change across time. Then also the relationship has to feel fair. And I got this thing about negotiation and compromise. I don't think people should compromise. You negotiate. That is, each person comes, I got this, you got that, we don't agree. Let's decide what's not on the table, and then we negotiate around all the other ones. Sometimes compromise is necessary, but please understand that compromise means giving up something that you need. And a supportive relationship that helps you grow and pours into you should not be asking you to give up stuff that you need. And then the last one, of course, that you got to share responsibilities that you define for your own self. I could go on and on and on, but I think this is a very important thing right here. The myth that Black folk have about mental health is I'm not supposed to go tell my business, and that's shooting us in the foot. So y'all ask me questions and tell me your business.
All right, that was a good introduction, Dr. Garrison, and it covered a spectrum that should be connecting with our listeners and people that are tuned in. So we're gonna go right to the questions right now. So again, I'm doing body, you're doing mind. I'm doing medical health, you're doing mental health. Let's get to it.
Let's get to it.
Okay, Lisa Parker, does menopause affect mental health, and what can I do to cope with mood swings?
Yes, Lord Jesus. So your physical doctor certainly can help you understand what medications will be helpful for mood swings, for hot flashes. Another thing that happens with menopause is sort of the brain fog. You gotta push through. What's happening is your body is saying, okay, I'm not going to have all these hormones that I had before. And hormones in our body are the messengers of many, many, many things, including emotions. So first of all, talk with your physical doctor and say, what is it that's going to be safe and healthy for me to do? Now, menopause, if we're going to talk about it from maybe a spiritual perspective, is this is a time where you are realizing as a woman in a female body, you're not getting, you are not anymore the person who's going to be creating a new life in terms of a whole nother human being. But what you will be doing in menopause is creating a new life for yourself. Women still always create. And so what menopause does is says, okay, I'm going to push you to be very, very honest with yourself, because there is irritability, there are mood swings, serve a purpose. Pay attention to them. The mood swings are not about, oh, let me just get rid of them. The mood swings is your body and your mind and your soul saying, sister, really? We're going to have to do something different. And this is how you need to look at it. So always full and radical self-acceptance. Listen to what it is that you need to change and know that you are still creating, but you're creating a new you.
Okay, that's a great mental health assessment. In the mental health frame, one of the things that I actively promote and perform is bioidentical hormone replacement therapy.
Yes.
As you stated so eloquently before, Dr. Garrison, that you don't have hormones that you used to have. And so now the problem is the deficit in those hormones. And they start to go down actually much younger than you think. As you start in your mid to late 20s, and then by the time you're in your 40s, the rates can be totally gone, or they can be markedly reduced to a point that things happen that you may not be aware of. But particularly the creation of what we like to say the mummy bod, you'll gain anywhere from 3 to 5 pounds per year. And you say, well, that's not a lot. But after 5 years, it's 25 pounds. So everybody now who used to have tight little waists, now they have a pooch. And it's not a fibroid. It's not a problem. It's just a part of what happens because the lack of estrogen stimulation redirects fat cell production to your abdominal area. So the abdomen and the hips are first affected. So that's one of the first signs. And then you're really dealing with things on a cellular level once you start to have problems with mood swings, brain fog, and all those types of psychological issues as well. Those are really your body telling you something's not right. So a combination of medical therapy, probably hormone replacement therapy, not the traditional hormone replacement therapy, that I'm not an advocate of, but bioidentical hormone replacement therapy, BHRT. You can Google it or talk to me about it offline. And then a mental health professional help you talk through the changes that are in your life and things you need to do to optimize your health and your self-worth and the way that you feel about where you are at that point in life. Okay, great question. Rhonda Holland is young. Please update me on what is calciphylaxis, what causes it, and your life expectancy once diagnosed, or if there are cure treatment. Okay, calciphylaxis, that's a good question. That term is not one that's in my medical. Have you heard of that?
No, I do not know what that
sounds
is.
like calcium.
Yeah, it sounds like something's getting calcified, possibly.
Reaction. So, or the condition of. So that is one that I will do research on to get back with you on that question. Go ahead. Okay, Ronald Scott, 50, African American. How can I set mental health boundaries in my relationships without feeling guilty? My husband is always in the mood. Okay. I would say the problem is, Dr. Garrison.
So it's the good news is both of you all still want to stay connected. You were trying to figure out how I can stay connected with this man, but also care for myself. And he clearly is trying to connect with you in apparently just only one way. So first of all, look at the positives. You all want to stay connected. Then look at what it is that your love languages are, because you all may not be communicating as well as you did before. I'm assuming maybe that you've been together for a while. So you need to sit down and talk about it. If you are having some problems setting a boundary and it makes you feel guilty, that means that taking care of yourself in that relationship has not been your tradition for most of the relationship. But if this is one that is long, I guess it's 50 has to do with maybe how old you are. That might be what that is.
Yes.
So
Yes,
that means that you have moved in how you see yourself. That's nothing that happens with women. By the time we get about 40 or so, we go, you know what? I've been doing this good girl thing for about 40 years. It's working for me, but in some places, just simply not working. It's time to do something different. And your hormones are starting to push you into being this next person that you're supposed to be, which means birthing more of yourself. So I don't think that you could be all that concerned about the guilt as you might be concerned about communicating clearly to this man, first of all, that you want to be with him. And that secondly, you might need an additional way to connect with him. Ask him what else he needs, because he's trying to get something from you. But also in heterosexual relationships, you got to tell the man, hey, I'm waving a flag up in here because something is changing. Something is not changing. I'm here for you. I've always been here for you. But guess what? Women continually grow and change. Men, maybe not so much. Women are used to cycles. That is how we do things. And so we understand that one thing turns into another, turns into another. That's not always the way a man has been socialized. So you just have to say to him, baby, come with me. And here's a way to deepen your relationship. So sounds like this man really wants to have some sex with you, which is always a good thing. And so you all work that out so that you find out what else you need, and that you cannot enjoy the sex if it is an obligation as opposed to a celebration.
Okay, boy, that hit home. Okay, calciphylaxis, that is a condition where you have calcium deposits, particularly in the blood vessels and also in other tissues, including the skin. Once you are diagnosed, there is no cure, but there are treatments that can alter. You can remove the calcium. You can literally surgically remove it. You can also use some intravenous therapies that will chelate the calcium out. And then hyperbaric oxygen therapy is also one of the options. So it's going to require a continuous therapy and treatment. You're going to have to partner with your provider. You and your doctor should become very good friends and come up with a plan that optimizes your health. And you're going to have to participate. I tell patients all the time, if you do half of the things that I request you to do, you'll do well. If you do everything I ask you to do, you'll do amazingly good. So, so those are the compromises. Some things are difficult to do, or there's an inertia with certain treatments. You just get tired of going to the doctor with a chronic disease state, and you get tired of doing those things that will give you some benefit, particularly when cure is not an option. When the cure is not an option. So chronic diseases are their own challenge, but you have to have a good relationship to get a good outcome. You got to have the right patient and the right provider, and you have to team and create a team that optimizes your health. So great question. I'm glad that was one of the most challenging ones I had. I had to do some research immediately.
I can't believe somebody came up something you didn't know. I'm impressed because you know everything.
Okay, next question, Alex. Okay, Constance Bell, good evening. Can you please repeat the side sleeping from this morning? I missed it, Dr. Kai. Okay, we talked about a Black woman's blessing, the relationship between the lower back and the hips and the thighs. Black women, of course, have increased muscle mass in their butt and their thighs, which is very attractive. Most men like it, and most women like the way that it makes them look. But from the ergonomic perspective, particularly when you are sleeping, when you sleep on your side, your back should be flat like this, but when you have hips, it arches like this. That tilts the lower portion of your back, the lumbar sacrum area, and that gives you what's called sacroiliac inflammation. That inflammation, you continue to try to find comfort, so you go from one side to the other. the other side starts to spasm and tighten up. So you try to switch back. What ultimately happens is your back is hurting, and now you're not sleeping, so you become chronically sleep deprived, which makes you anxious. That stress hormone cortisol comes out, makes you gain weight, particularly in the abdominal area. So it creates a real problem. And so again, living this in my personal household, I know that the body that you used to love back in the day now kind of comes back to haunt you. So what you have to do is change your sleep posture, and that means laying flat on your back, possibly with some support, to test this theory to see if that gives you some analysis. You take a towel, just a regular towel, fold it, roll it up like this, put the rolled up part under your back, in the small of your back, and this portion under your butt, kind of hold it. If you need to, you can pin it so it won't unroll, and you'll find you're going to get the greatest night's sleep of your life. This is not a situation where necessarily a firmer mattress is going to help. Although everybody's going to tell you need a new mattress. This is strictly the ergonomics of your spine, your butt, your lower back, and the posture that you're in. Now, there are back pillows that you can purchase once you see that this is actually going to give you relief. And then other things like muscle relaxants and anti-inflammatories can assist. I'm a big proponent of stretching exercises, yoga, Tai Chi, all of those things that will help loosen your back up. But this will only get worse over time. The inflammation will become degeneration. You'll have osteoarthritis in the back, and that ultimately results in needing back injections and possibly back surgery. So we don't want to deal with that. So when it's something that we can help prevent, slow down, control, whatever you want to call it at this point, and continue doing what you're doing. But most people find comfort sleeping on that side. Don't recommend sleeping on your stomach, because then you have to go into the swimmer's position. You have to turn your head one way or the other so you can breathe. That creates neck and shoulder stress. That won't relax. Then it migrates down to the lower back as well. So the best sleep posture is literally laying not just flat on your back. If you have the ability, if you have an adjustable bed, let it up about 10 or 15 degrees so that you aren't flat, because that can induce snoring. So arch a little bit. You can do that with, if you don't have an adjustable bed, 2 pillows behind the head and the neck, 1 pillow behind the shoulders, and that sets you up a little bit, and that will make it more comfortable for that sleep posture. And then you can get my Lipo Nights, which has the melatonin in it, which will help you get a good night's sleep and also burn fat and make you lose weight while you're sleeping. So one of the things you can do, go to the website, lipodrops.com, more information on Lipo Nights. Okay, great question, Constance. Okay, Rita P., can you explain the symptoms of schizophrenia and how to recognize if someone close to us may have it? It's hard to know if to believe them sometimes.
Yeah, schizophrenia is in the category of thought disorders. And so what that means is that the person actually has some broken reality testing. There are a lot of different kinds of schizophrenia that's schizoaffective. So there's a continuum of that. I'm struggling with this a bit because, I worked at Grady, I worked in Morehouse Healthcare, and I always hear people, my mama been diagnosed with bipolar schizophrenia. And that's not exactly what that is. Some of this is very cultural, in that if any person of color shows up and has anything that looks like it might be a hallucination, then they're schizophrenic. But we have a lot of spiritual traditions that sound like we have an hallucination. We talk to God all the time. So that is one issue. It is a real thing, schizophrenia. It is a real thing, bipolar 1 and 2. So the way that you can really tell it is that there is a pervasive problem in functioning across all the areas of function. It's not like they're okay here and looking at TV, but then when they go out to the store, they act a fool. It's not that. It's the whole thing. For some psychotic disorders, people normally have a first break in their 20s, or when they get to the point where they are now leaving the primary family unit. So there are some breaks there, and a psychotic break really is, I'm talking about things that it's not really there, and I'm seeing things that's not there, and I'm hearing things that's not there. I may be smelling things that's not there. And I also need you to understand it's different from delusions. A delusion is something that somebody really, really, really strongly believes, and at a certain point, logic doesn't make sense. But that's not a psychosis. That's not a psychotic event. So you want to ask the person if you might be able to speak with their mental health professional. And if there is no mental health professional involved, then the whole terminology schizophrenia is moot because no one has actually fully diagnosed that. There are so many things that can cause a person to have psychotic issues. We can have depression with psychotic features. Somebody can get so depressed that they hear things or they feel things temporarily. You can have anxiety. You can have OCD. There are a lot of things. You have thought disorders. You have affective disorders of the emotion. And those are different things. So you got to talk to somebody. And if you are concerned or confused or it doesn't make sense, go with that and ask for some more information.
That is a very good breakdown, particularly with oftentimes people of color are easily and quickly diagnosed with schizophrenia, and then they're placed on medications, but they are never actually given a diagnosis. A thorough evaluation might be a better way of putting it. Nobody's talking to them to try to figure out the nuances of the disease state. And so, and then they get under the care of a psychiatrist, and they go to the psychiatrist, and two questions: is your medication working? Yes or no? And if it's not, they increase the dose or change it. If it is, then thank you. We'll see you next time. No additional discussion about how do you feel and those sorts of things. And there's the limits of time. And schizophrenia is not an attractive disease. People don't want to get into the weeds of it because it's going to take time. It's a challenge. And so, the average medical visit is for a physician is no more than 15 minutes. That is the business model. For a psychiatrist and psychologist, they bill by the hour, but most people don't get 60 minutes. They get less than that. They don't get
60 minutes with a psychiatrist. They can get 30, 40 minutes with a psychologist or a therapist of some sort.
Yeah.
And also, a diagnosis of schizophrenia does not mean that you are dysfunctional in your whole life. That with proper medication, there definitely is certainly an engagement in life. And there's schizophrenia and there's paranoid schizophrenia. And Black people also never got diagnosed paranoid schizophrenia because that is considered an intelligent schizophrenia of sorts. Like that's really high. And most of us really are paranoid, if anything, with the schizophrenia. So you really need to find a team of mental health professionals and physical health professionals to work on this. And then to educate yourself. And then, as I said before, reality test, see what it is that works, have an honest assessment of you and the person that you're dealing with, and then see what's possible. Always see what's possible. Do not spend all your time on what's wrong. What's possible? That's how we're going to get through this thing.
Oh, great point. Great point. And, schizophrenia is a chronic disease state, and people can be treated and do quite well, but they will cycle. The biggest problem is that if they're on a medication that works, they do great. And then they feel like, I don't need to keep taking the medicine.
And I stop taking the medicine.
They regret quickly. Or sometimes you can take the medicine just as it's prescribed and still will cycle. And we really have not figured out why that happens, but it does happen. You've heard it euphemistically described as a moon phase, and things happen in certain times of the year and all those kinds of things. And that is a truism. They just didn't know how to eloquently describe it. They just described what they were observing. And so they related it to seasons and moon phases and all those sorts of things. But I have seen patients that, no matter what, they will cycle. That's just the nature of the disease state. So great question. I'm so glad that Dr. Garrison was here to answer that question, because there's a dearth of mental health discussion. And that's what we're here for, to discuss. Okay, great question. Okay, Instagram question. Taz K, is that Taz, aka Mac? I can't. Taz Kakamac? I don't know. Dr. G, what are your favorite movies you feel that depicts a good understanding perspective of any mental health disorder? Boy, that is a great question.
That's a great question, except, I don't remember the specific movies that I look at. So I forget the one, but it might be something about As Good as It Gets, but it was with the guy that did Here's Johnny. I forget what his name is. But he depicted someone
that's
that
Jack
has
Nicholson.
Jack Nicholson, right?
Yeah, and As Good as It Gets was a great movie. He was the
but
next
it was
door
the other
neighbor.
movie that he depicted an older guy that had OCD, and so you saw the whole trajectory of that. I think it's As Good as It Gets, where you get to understand how restrictive a person's life has to be with managing all of the you have compulsions, that I have to do this way, I have to do this way. And obsessions, there's this germs, it's going to happen. So there's a process in place. This is an affective disorder. This is a disorder of the emotions. It's not a thought disorder. They are not psychotic. But the movie showed that it's very difficult for people to have relationships, but it's not impossible, because to me, it showed the idea that we have these categories of people that we call diagnoses, and we put them in boxes, but it does not ever fully explain the whole person. And so you saw him move past that. I also have to say that my job involves some of the really deep things with people. And so I look at movies for fluff. That's what I'm gonna have to do. So I would like to say, though, that the question is a good one, because I think you're asking, so how do mental health things play out in real life? You know, professionals talk about this. You go to somebody's office and then they got to go home and live a life, and that the movies show the life. There was a movie, A Beautiful Mind, where the guy was schizophrenic, and it also shows you how it's not ever what just one person says. There's no one face to any of these mental disorders, and which is why I say, first of all, you have to have information, and then you have to have a good team, and then you have to have the expectation that we're going to live with this because there's something besides the disorder. I hope that was enough of an answer for you.
Those are two great movie references, As Good as It Gets and A Beautiful Mind. The Beautiful Mind was a great. This guy was a mathematician who was schizophrenic, but he would see numbers and things just in the air and just was brilliant. So that just goes to show you, mental health does not just affect people that we consider on the spectrum or slow or whatever. You can be in any mental state. You can be average. You can be brilliant. You can be, slow. Any of those things, and you can still have mental health disorders. So those two things are not congruent. There's discongruency with that. Okay, great question. That's your homework. Go watch those movies and get back with us. Okay. Mother-daughter relationships. Oh my God. You say you like to deal with young people. This is a good one. How can one deal with those?
Okay, so once again, this is a very, very multi-layered question, because this is about generations. It's about generational communication. It's about growing. It's about healing. It's about traumas. It's about what it is that we did not talk about and what we will talk about. It's about one generation letting their pain leak into another generation. It's about forgiveness. It's about grace and compassion. So what I will say, I have 2 grown daughters, and we're all struggling here. Better now, but we're all struggling. So, there was a young woman who I did a workshop for college and high school people, and I asked them as an icebreaker, so tell me what you think people in their 60s don't know about your generation. And they told me lots of very important, very, very, very powerful things. And then I was supposed to tell them what people in our 60s, what you don't know about us. But one young woman in college said to me, "Why didn't you all tell us the truth?" And it just zinged me in my heart. So what I'm going to say is that I think the difficulty is women haven't figured it out when their daughters are watching them so closely. And by the time we find our voices, by the time we figure out, oh, this is the truth, and I can be courageous enough to say it to you, because we've had to have several generations where now mothers are given permission to tell the truth to their daughters. By the time we figure that out, daughter's not listening anymore. And then there is also the other complication of the relationship that the daughter was also looking. Mom is growing as well, like that other question about how do I not feel guilty about my husband? Okay, well, we have new definitions now, but she didn't have those then, and your daughter was seeing those. So it is going to be complicated, and it's going to be a little messy. If it's not messy, I'm wondering, are y'all being honest? So, but the messiness is necessary, and that I think both sides need to give some grace and some compassion, and also to give some space, and then, but to not ever give up. So keep coming back. My youngest daughter keeps hammering at me. And so one of the things that I had to learn is that when she's telling me how I screwed up, which I did on many occasions, I wanted to explain to her how that wasn't my intent. But that's not what she needed. What she needed was just to know that I heard what she felt. That's a generational thing. And both sides have to be courageous enough to really try to stay in there and say the truth and to trust in the love enough that you can go ahead and fight a little bit and hurt a little bit, but know that it is actually going to work out fine.
All right. So that means it's going to take some work. Mother-daughter
It's
relationship.
going to take some work.
You
Oh,
got
and let me
to
say this.
open up the Pandora's box, but I tell you, it's going to require a lot of discussion in doing so.
Yes.
And so not just mothers and daughters, but because when you
Fathers,
transition
sons.
from
But
the
Dr.
child,
Carter
the
also,
adolescent to the adult, and you got two basically adults living together or and trying to live together, and the daughter now has a child, so the grandchild, and the mother's giving opinions
right,
about raising the babies,
right.
and all of
But
this.
I also have to say, those young people also did point out to me that sometimes parents can't do that. Sometimes mothers cannot mother. Sometimes it is that parent has been so harmed and so traumatized that they really don't have enough there in them, at which point the grown child has to say, that's not the place for me right now. I want to give people permission also to know that sometimes it's not workable. And that does not mean that the parent means you harm necessarily, but we've got to remember that trauma is generational and it is deeply held, and it also is affecting the body and the mind. And sometimes if you cannot work that out because that parent cannot be a parent for you, maybe not blame them, but understand that's the best they've got, but you still have a right to go and get yourself cared for. That's your mother, that's your father. It doesn't mean that you have to stay there and be abused, though. It means that you can still go get what you need with the hope and the faith that healing will come at some point.
Okay, next question, Alec. Great question. Latoya Smith, what is the difference between panic attacks and anxiety, and what are the most common triggers, and how can I avoid them?
Okay, Latoya, you can't avoid them. Panic attacks and anxiety are the same thing. Panic attacks are because you are anxious. Anxiety brings on panic attacks, but a panic attack is when you have an impending sense of doom and you're pretty sure you're not going to get out of this. So there are a lot of physiological issues going on. Your heart is pounding, you're sweating, you think that I'm not going to make it through this. Triggers are very specific to the person. So whatever causes you anxiety is your trigger. The things that you can do though to help with that, once your body starts being anxious, your brain then agrees. Your body says, oh, my heart's pounding. Yes, we're anxious. And your brain says, yes, we are anxious. Let's just go and get ridiculous. So if you can calm your body down, sometimes that works. That's the mindfulness, that's the breathing, that's sometimes taking a cool bath or a cool shower or walking outside. There are a lot of things that can downregulate the nervous system. And that says to your brain, hey, we really aren't that anxious. And it works in both directions. If you can calm your mind down a bit, your body will agree. So there are some things that you can do in the moment. The way to avoid your triggers is to accept them and to work with them and to learn from them. And that again generally requires the help of a mental health professional. When you approach yourself and your anxiety as something that has to be beat into submission or surgically removed with a scalpel, that's not going to be a very good approach, because this is you. If you will learn from what's going on, then you will always be able to have a way to address that particular trigger and ones that are similar to it.
That's great. Now, oftentimes a panic attack, particularly in the early onset, will result in a visit to the emergency room because people have that sense of impending doom. They think they're dying or that something bad is really going to happen. And so the first thing they should do is rule out a real event. Are you having a heart attack? Are you having a stroke? And oftentimes women are misdiagnosed. They actually do have cardiovascular issues, and they're not evaluated from that. They immediately classified as this is anxiety, this is a panic attack. And so they're treated for that, and then they go home and they have a heart attack. And so there's a whole conscientious effort called the Red Dress Movement that talks about, because women have more cardiovascular disease than men, the incidence of heart attacks and strokes and deaths associated with it is higher in women now than it is in men. And that was never the case. And now it is. But again, so clearly, once you realize that that's not the case, you aren't dying, you're not having a heart attack or a stroke, and that your physical health is indeed intact, then you deal with your mental health issues. And it don't have to be mutually exclusive. You can do both at the same time, but you want to make sure that there actually is no real event going on that's being ignored by a healthcare provider because, quote, it's just a woman doing woman stuff. And that is a big, big problem, particularly with women of color. They have done studies where they have white women present with the exact same symptomatology and a black woman present with the exact same symptomatology, and they both get different evaluations, they get different workups, as they call it, in the emergency room and in the hospital. The endpoints are different, and oftentimes it leads to neglect in the healthcare of the woman of color. So you have to be your own advocate and make sure that is not the case. But once it is determined, yes, it actually is a physical panic attack, that anxiety that's resulting in physiologic symptoms, then the mindfulness, I love that word mindfulness, and ways of things that you can do. I like to say meditate. I like to say prayer. No matter what your God is or who your God is, if you have a spirituality about you, if you don't, you need to develop one. If you do, use that spirituality to help maintain calmness and bring calm to yourself, because you're well aware of what it is, and you know what your triggers are. And again, now knowing that you can't avoid them, because life happens, things happen. And you can't control those triggers. You just have to be able to deal with them. And so,
you may have more than one emergency room visit, and that would be all right, because all of that is gathering information. Think of it
absolutely.
That way. Yeah, absolutely. So that's okay.
Latoya, you get it. Next question. Vanessa Sanders. Hey, Dr. Collier, order your 3-pack vitamins. What are the vitamin D pills? Why are the vitamin D pills white? Never seen pills like this. I don't want to take them. Please let me know. Thanks, Vanessa. The vitamin D pills should be a yellow liquid caplet, but sometimes the caplets are in short supply, and they'll send a vitamin D that's in a pill. But I can assure you that if it says it's vitamin D on the bottle, it is actually vitamin D. We have quality control measures in place, and the vitamin D, the daily dose, Dr. Collier says, 5,000 international units per day, that boosts your immune system. A normal vitamin D level is measured from 30 to 90, but you get the first benefit when you get that level above 40. At a vitamin D level of 40, you get strong bones, strong teeth, healthy skin, healthy hair, and your immune system function is optimized. That makes you less susceptible or not susceptible to viral infections like the flu, the common cold, the coronavirus, bacterial infections like strep throat and pneumonia, fungal infections like fingernail fungus, toenail fungus, vaginal yeast. All those things just are not a part of your health structure, because they cannot live in your body when your vitamin D level is 40. It just makes it very difficult to do so. Get that level up to 60, and it's cancer prevention. And so multiple studies have shown various types of cancers, including breast and colon cancer, rates are much lower in people whose vitamin D levels are 60 or higher. Now, this is the problem. People come to my office, they never had the vitamin D checked, and I check your vitamin D as a part of your routine comprehensive physical examination. When you get blood drawn, I'm going to check your vitamin D. And some people, you can't measure it. I had someone today whose vitamin D level was 6. Totally non-functional. I mean, weak bones. I say you fall down, you're going to break something. And so it's just a simple matter and a very elegant thing where you can take, at that point, they need a prescription strength vitamin D tablet, which is 50,000 international units, not 5,000, 50,000. So a 10 times higher concentration. And but the great thing about that, you only have to take that one time per week. And it is a very elegant way to optimize your health. And that's why it's one of the supplements that I highly recommend, because it decreases inflammation, changes your health status, and makes you feel much better. Okay. Samantha Moore, I'm 52 and caring for my mom, 88, sandwich generation. Sometimes it is if she wants to drive me crazy. How can I maintain my mental health while caring for an aging parent? Boy, that's the question of the day.
Yeah, because I wouldn't be surprised if you're sandwiched in between an aging parent and some grownish children. And so you have both of those things going on. The issue is, let's see, how do I want to say this? You do have to set healthy boundaries for yourself, which means most likely setting boundaries with your mother that you had not set before. an aging parent makes it very difficult because you want to see them as the parent, but sometimes you have to treat them as someone that you are caring for and in charge of. And you've got to figure out how you set those boundaries that are good for you and for your parent. And the way to do that is to pay attention to what you need, how you feel, to understand that when you feel respected, when you feel heard, or just when you feel that you have some freedom and some space to breathe. The relationship you have with your parent will, of course, determine what those boundaries look like and what is possible. But just understand that this is a natural part of life and that this is also a part of you continuing to grow yourself up. And you will be surprised that if you are clear and direct with this aging parent, if there's not some significant cognitive disturbance, you might get something out of them that you would not have expected. Also understand that your aging parent is really struggling with the aging. Getting old certainly is not for wimps, and it is a surprise. I don't care how much you talk about it. My body won't do this, my body won't do that. For aging parents, I can't remember this. So a lot of what you're seeing also in your parent most likely is anxiety and depression, because this is a change for them. And we don't talk about it because it scares us, but our parents have to grieve the fact that they aren't who they used to be. And interestingly enough, so do you. You have to grieve. This is not the parent that I used to have. And now we have a whole new set of things going on. So give everybody some grace and some compassion, meaning that what you need is not more important than what your aging parent needs, but it is as important. And so if both of you all were on the table equally, what would you decide? How would you do this? What would it look like? And that is what you have to do. That is what you have to do. And you have to use your internal emotional state to tell you if you're doing the right thing for you or not. And get support from other family members as often as you can.
Often as you can. The first thing I ask and request of a family, particularly when there's more than one child, is share and spread the burden. If you assume it, then that solves the problem for everyone else.
Yes.
So as long as you're doing the work, nobody else is going to want to step up. So you have to have the family meeting and have a real conversation. Okay, it's three of us. We're going to split it 3 ways. We'll take 1 week at a time, or however you want to do it, so that the burden is shared and that you get some time to decompress and some respite time, as they say, for your own mental health from the perspective. Understand that, again, the parent is challenged. They will lash out at the person that's there. You're the most convenient person. The caregiver is oftentimes the one that's given the most grief. And the person that comes by and visits every once in a while is greeted with enthusiasm and authority. And just like, oh, I'm so glad you came. You my favorite. And all of those things. And you're sitting there doing the hard work all day, every day. Yep. And you feel like it's not appreciated. And oftentimes it really isn't appreciated. That's the problem. And so you have to really spread that, understand it is a blessing. Your mother's 88. At some point, you will be relieved of this burden. And you will say, you will really appreciate the time that you had to spend with them. Spend the time doing positive things like having a conversation. Oftentimes, it's not just about what your medication is. Have you taken your medicine? What do you want to eat? And when your next doctor's appointment is. They want to talk about other things. But there are some things they need to talk about from people that know what they like and do. The friends, family. Right. The problem is at 88, your mom doesn't have a lot of friends that are still here. Most of them have already passed. So now her tribe, as you like to say, Dr. Garrison, needs to change a little bit. And so if you have a relationship with a local church, particularly if she's been a member, there are members there that can come and provide home visits and give you some respite. At 88, depending upon her health status, hospice care is absolutely amazing. Hospice is not a place that you go to die. Hospice is a place that helps you with the transition. And I'm a strong advocate of hospice care. And every time somebody finally puts it in place, they say, boy, I wish I hadn't waited so long, because these people, it doesn't cost anything. There's no cost for hospice. It's covered by Medicare. And so they will come to your home. They will bathe. They will clean. They will do everything and give you some opportunity to do the things you need to do. Go buy groceries. Go get your hair and nails done. Just get out the house so you can relax and decompress. Go to the movies. whatever you like to do. So all those are things and options. Utilize any support that you have that's community-based, but put your family to work as well.
But
If
let me
she
say
has
two other
go ahead.
things. One is that try not to avoid the family meeting was an excellent suggestion, Dr. Collier. Just because you know it's going to be family drama, please understand that there's going to be a bunch of stuff coming up because mama's not in charge anymore, but that's okay. Go ahead with that anyway, because this is another opportunity to grow and heal the family. And being with mom works best when you are with her the way she wants you to be, not the way you think you ought to be, which is
Exactly.
what I think was already been mentioned. But that's a very important thing. This is the time for you to realize the other parts about your mom as a human being, a person, a woman who was a woman before you were born, and see what that's like. This is an amazing opportunity for you to get to know that part.
Oh, great question. Next question, Holly. Okay, Thomas Green, can poor sleep habits lead to mental health issues such as anxiety or depression? If so, how can I improve my sleep while dealing with financial issues?
Wow.
One, you got stressors that are bothering you, and that is a big problem. Financial, whatever the issue is. In this case, you identify financial issues. That's not
Right.
going to go away or be solved quickly. So, one, the good thing is that over time you accept it and you learn to deal with it, because guess what? The sun comes up tomorrow. Tomorrow you will survive, and things will be better as you deal with it. Sometimes there's no good resolution to a problem like that, but there is resolution. And at some point, you'll be relieved of that burden one way or the other. Now, when you have poor sleep habits, you're not sleeping well. Sleep deprivation is the number one form of torture that exists. They don't have to put bamboo under your fingernails. They don't have to beat you and waterboard you. They just don't let you go to sleep. Within 3 days, you are ready to just lose it all. That is so. It's very important to get not just sleep, but good restorative sleep. You got to get to the REM sleep stage where you're having dreams and that your body is healing and restoring itself. So this might be a good opportunity to take a sleep aid, something that can help you sleep. And I recommend starting with over-the-counter things, anything that says PM, Tylenol PM, Advil PM. The PM portion is diphenhydramine, which is just Benadryl. It usually is in 25 milligram dosage per tablet. It's going to take at least 2 of them to give you some good sleep. So don't hesitate to do so. It's not addicting. It won't impair your ability to get good sleep without it, but it will, and it'll be out of your system within 4 to 6 hours. So as long as you don't take it at 4 o'clock in the morning, you won't have daytime sleepiness the next day, unless you're just so sleep deprived and fatigued that you still, because you can't catch up on rest. You can't store it. You can't have a restful week and then on weekend try to make it up, sleeping 12 hours, 14 hours. It doesn't work. You can't do that. You have to get a good 6 to 8 hours every night. Most people strive for 8. Nobody gets it. If you can get 6, that's good enough for most real people. 6 hours of good sleep, quality sleep, will give you that benefit. So the anxiety portion.
Right. So let me also say that if you make getting good sleep a priority, then you are going to be addressing your mental health issues because you're putting yourself first. So when you decide I need to get good sleep, even if you're going to take some medication to help you sleep, you got to get in bed in time enough to take it. So what I want you to understand is that you are addressing the issues with possibly making you anxious and also the depression. Those are cyclical. Depression and anxiety can keep you from sleeping, and not sleeping can help you be depressed and anxious. So if you want to break that cycle by deciding to do something different, that is prioritizing your mental health, even in the face of the financial issues, that is a very, very healthy way to approach your life, this part of your life, and any of the problems you have going forward. So look at throughout your day how you're thinking throughout the day, because anxiety and sleep problems start well before we get to bed. So think about what it is that you are obsessing about and separate the things that you can actually do something about, that you have some influence over, and the stuff that you just keep worrying about that you can't do anything about. Put those off to the side, not because you aren't a responsible person, but because you literally don't have control over some things. Do what you can for the things that you have influence over, and then prioritize your health. That is, eat well. That is, maybe walk some before bed and have some good sleep hygiene. Do not, I've heard Dr. Carter talk about this before. Don't have the TV on at night. Don't be trying to do the phone. Don't do whatever it is that helps your mind and your body get on the same page, which is calm and sleep, medications can help. But know that this is an excellent question. You're already on the right road because you're trying to figure out, how do I care for myself? And that's the most important thing.
That's the most important thing. Okay, so now this brings to a close this episode of the Ask Dr. MJ Why, because your health is important broadcast with our very, very special guest, Dr. Shawn Garrison. Ask Dr. G. She's going to be a regular guest. I hope you enjoyed all the information that Dr. Garrison gave you this evening. It was absolutely amazing. Dr. Garrison, thank you for blessing us with your presence. We greatly appreciate you. We look forward to your next appearance. So this is how you can reach her. Dr. G Speaks at JanaeHicks.com. Dr. G Speaks at JanaeHicks.com.
Thank you so much. This was fantastic. I had a ball.
Thank you so much. We appreciate you, Doctor.